pressure was 182/100. And I had a heart attack and a cardiac arrest and then a stroke. I was in total denial that there was anything going on wrong with my body, even though I was a nurse. I didn't pay any attention to the headaches or the dizziness, or my memory was kind of coming and going. I just thought it was because I was so busy being a mom. It's embarrassing that I didn't pick it up in myself, but my heart stopped and I was flatlined, and they had to resuscitate me, but it took quite a while. I went from running 25 miles a week to not knowing my children's birthdays. My oldest daughter had to raise my youngest, who was at that time 4. I mean, everything changed. It felt like my life was over. Then somehow I decided that I had to get better for my kids. And I dreamed that my memory will come back to what it used to be. And I'm doing everything that I can to make sure that it never happens, because I don't think I would survive the next one. Still, it's never going to be like it was.
Good evening, everyone, and happy spring. Thank you for joining us this evening for the Hypertension Summit presented by Lehigh Valley Health Network. My name is Tamara Raymer, and I'm a Community Impact Director with the American Heart Association, and I will be your moderator for this important discussion tonight. As you may or may not know, hypertension, or maybe better known as high blood pressure, is a silent killer. But did you actually know what high blood pressure means? High blood pressure is when the force of blood flowing through the blood vessels is consistently too high. As you can see on the screen, we've provided you with an image showing the American Heart Association's healthy and unhealthy ranges for blood pressure. We should all aim for a blood pressure reading of 120/80 or less, which falls into that normal green category for optimal health. High blood pressure can threaten your health and quality of life. In most cases, the damage done from high blood pressure occurs over time. Left undetected or uncontrolled, high blood pressure can lead to things like heart attack, stroke, heart failure, kidney disease or kidney failure, vision loss, sexual dysfunction, angina, and peripheral artery disease. As you can see on the screen, Lehigh, Northampton, Schuylkill, and Berks counties all have higher number of adults with high blood pressure than the state and national averages. Nearly half of all Americans have high blood pressure, but may not even know they have it. As we just learned, high blood pressure can cause a stroke, heart attack, and other health threats. If you don't already know your blood pressure numbers, we highly encourage you, go get yours checked. We will post a link in the chat if you would like to review our website and learn more information about blood pressure, and also find some helpful resources. Just so everyone knows, we are recording the session today. It will be available on our American Heart Association Eastern States YouTube channel, and we will be sharing a link to that video on our social media pages, AHA Pennsylvania, on Facebook, Twitter, and Instagram. Let's get social right now. We'd love for you to introduce yourself in the chat box. Please add your name and or your company, where you are joining us from. It could be your city or county, even if you're out of state. Now that you know how to use the chat box, throughout the presentation, please place your questions and comments in the chat. We will ask your questions during a question and answer session with our speakers at the end of the presentation. Tonight, you're going to be hearing from 2 specialty doctors from Lehigh Valley Health Network about cardiovascular health and stroke. Now, to get us started, I'd like to first introduce Dr. Preet Varade, who serves as the co-medical director of the Lehigh Valley Physicians Group, Neurocritical Care, and practices at LVHN Cedar Crest. He specializes in acute neurovascular care, neurocritical care, and neurotelemedicine. He completed his medical training at St. James School of Medicine before completing his neurology residency at Wayne State University Detroit Medical Center. He then completed a vascular neurology fellowship and neurotrauma critical care fellowship. Welcome, Dr. Varade, and thank you for joining us this evening. We're very interested in learning more about how our blood pressure can impact our brain health. If you could hop on video with us now. There you are.
Hi, good evening.
And I'm going to open up the floor for you.
Thank you. So I'm here to talk about blood pressure and brain health. The stroke is a leading cause of death and severe long-term disability. Most people who've had a first stroke also have high blood pressure. There's several other risk factors as well, including diabetes, cholesterol, irregular heart rhythms, and most of the risk factors that cause strokes also cause heart disease, as you'll hear about later. High blood pressure over a long period of time damages your arteries and creates conditions in which they can burst or clog much more easily. Over time, the impact of high blood pressure on your vessel walls causes them to harden and makes them much more susceptible to building up plaque and rupturing. These weakened or blocked arteries in the brain put you at a much higher risk for stroke, which is why managing high blood pressure is very critical to reducing your stroke risk. A stroke occurs when a blood vessel to the brain is narrowed or blocked by a clot or a burst. The first type is called an ischemic stroke, and that usually happens when there's blood flow that's cut off because there's a clot inside your vessel. If you can imagine a clot in your drain that prevents water from kind of getting through to the other side, a similar thing happens in your vessels where a clot prevents blood from getting to the other side. In doing so, there's a period of time where there's no oxygen to your brain, and brain tissue starts dying. The other type of stroke, which makes up about 15% of the strokes, is called a hemorrhagic stroke. And in this case, when your blood pressure gets really high, it can start weakening the vessel walls and eventually puts you at risk of having little aneurysms in your blood vessels that rupture. This can cause bleeding into the deep tissues of your brain. So a stroke is a medical emergency. Anytime that you have a stroke, it can cause lasting brain damage, it can cause long-term disability, or even death. And signs of a stroke can range from mild paralysis, mild weakness, or numbness to one side, including the face or the body. And it could also include complete paralysis on one side of your body, and severe disability to the point where you may not be able to breathe on your own or eat on your own. Whenever you suspect there's sudden onset of weakness, headache, trouble seeing, trouble speaking, or understanding someone's speech, you should think about a stroke. And if you think that you or someone else is having a stroke, you should call 911 immediately. This is not the time to drive to the hospital. This is not the time to let somebody else drive you. There's protocols in place to have an ambulance come and pick you up so that we can start our pre-hospital treatment and care immediately and begin life-saving treatment as soon as possible. During a stroke, every minute counts. You can spot the warning signs of a stroke by remembering this acronym called FAST, where F stands for face drooping, A stands for arm weakness, S stands for speech difficulty, and T means it's time to call 911.
All right, thank you, Dr. Varade, for helping us better understand how high blood pressure can impact our brain health and our risk of a stroke. Please make sure if you have any questions for Dr. Varade that you add them into the chat box now as we move on to our next guest. All right, so yeah, there we go. It's my pleasure to introduce our second and final presenter tonight, Dr. Yaqub Mohidin, who serves as the Associate Chief of Division of Cardiology at Lehigh Valley Health Network and practices at Lehigh Valley Hospital, Hazleton, and Lehigh Valley Physicians Group Cardiology Health and Wellness Center at Hazleton. He completed his medical training at the Brody School of Medicine at East Carolina University before completing his internal medicine residency at the University of Virginia Medical Center. He then completed a fellowship in cardiovascular disease at Hartford Hospital in Connecticut. Dr. Mohidin is passionate about enhancing the level of cardiac care that can be received locally and limiting the need for patients to travel out of town for quality cardiovascular care. Welcome, Dr. Mohidin, and thank you for joining us this evening. We're really interested to learn more about blood pressure and how it affects our cardiovascular health.
Thank you, Tamara. Thank you, Dr. Varade. We're going to talk a little bit about high blood pressure and how it can lead to heart problems, heart attack, stroke, and also congestive heart failure. Risk factors for heart disease or stroke or vascular disease, they're all the same. It's the same disease process, whether it happens in the heart, in the blood vessels going to the brain, or blood vessels in our abdomen or legs. Same disease process, same risk factors. High blood pressure is one of the leading risk factors for heart disease and stroke. Every 34 seconds, someone in the US dies from cardiovascular disease. Each year, a little over 800,000 patients have a heart attack in the US. In our area, the Lehigh Valley area, there were 17,882 heart-related deaths between 2016 and 2020. And approximately 1 in 4 Lehigh Valley adults are currently living with high blood pressure. And nearly half of those that have high blood pressure do not have it under good control. The rates of high blood pressure or hypertension differ significantly, and they increase with age. In general, over the age of 40, there are close to 47% of the patients that have blood pressure that's higher than what's considered normal, and normal being 120/80. In Pennsylvania, 62% of the Medicare population, most of the patients over the age of 65, have high blood pressure. And the diagnosed hypertension varies by county and ranges in our area from 19% to 33% of the entire adult population in each county. A heart attack occurs when the blood flow that brings oxygen and nutrients to the heart muscle is severely reduced or stopped. This happens because the coronary arteries, the arteries that are supplying blood flow to the heart, they slowly become thicker and become hardened and have plaque buildup from fat, cholesterol, and this slow process is known as atherosclerosis. If the plaque, which can break open, it forms a blood clot, and that clot ends up occluding the blood flow to the heart, and that causes a heart attack. One of the ways to think about it is, the arteries, the inside of the arteries is no different than really our skin. If we have a little scab in our skin, the scab is healed. Same thing happens in the inside of blood vessels. We constantly have small pieces of plaque breaking, repairing, and then sometimes those pieces of plaque can break off. And if they completely occlude a blood vessel, that's a fairly dangerous heart attack where, if you've heard, mostly patients are flown to the closest cardiac catheterization lab. They have to emergently have their blood vessels opened up, as opposed to slow process of plaque buildup, which over time causes significant narrowing in the blood vessels and causes angina and heart attack. That's a little different type of a heart attack where there's not a complete occlusion of the blood vessel, but there may be a little trickle of blood still flowing through, as opposed to a ST elevation myocardial infarction, a heart attack where there's complete occlusion of the blood vessel, where we have to emergently go in and open the blood vessel. What about blood pressure? So there are two numbers to a blood pressure: the systolic blood pressure, which is the top number, and the diastolic blood pressure, which is the bottom number. The systolic blood pressure measures the pressure in the arteries when the heart is beating. So when the heart beats, that pressure is transmitted to the arteries, and that's called the systolic blood pressure. And a normal systolic blood pressure is less than 120 millimeters of mercury. The diastolic blood pressure is measured at the time when the heart is relaxing. And this is the pressure that arteries see when the heart muscle relaxes and the heart muscle fills with blood. And it is called the diastolic blood pressure, which is usually 80 millimeters of mercury or less. So making a normal blood pressure 120/80 or less. How do we ensure an accurate blood pressure reading? So what I usually tell patients is anyone that's really over the age of 40 should have a blood pressure machine at home and should regularly 3 to 5 times a week check their blood pressure, even if they don't have a history of high blood pressure or a diagnosis of high blood pressure. Because with time, as we get older, blood pressure increases. Now, how do we take an accurate blood pressure? So there are 7 simple tips to get an accurate blood pressure. First of all, we have to make sure we have the right cuff size. Having a cuff that's too small adds anywhere from 2 to 10 points to the blood pressure. Making sure that we're sitting quietly, having a conversation increases blood pressure by 10 points. Making sure that your bladder is empty first. That, by not having an empty bladder, that can add up to 10 millimeters to your blood pressure. Making sure that the back and feet are supported. Making sure that the legs are uncrossed. Supporting your arm at the heart level, putting it on a desk or a table when you're taking the blood pressure. Putting the cuff on bare arm. What are some of the common risk factors for hypertension? When we talk about hypertension, there are some things that we can change, some things we cannot change. So we cannot really change who our parents are. So if there's a strong family history of hypertension, high blood pressure, there's a chance that as one gets older, they're going to develop blood pressure. Age is a risk factor. As I said earlier, over the age of 40, up to 47% of patients may have high blood pressure. It's just not recognized. Diabetes can increase the risk of high blood pressure. Patients who have prehypertension, meaning blood pressure that's not quite considered to be high, meaning less than 130/80, but greater than 120/80 is considered prehypertension. That's going to increase the risk of someone developing hypertension with time. Some of the behaviors: unhealthy diet, high salt diet, inactivity, obesity, drinking too much alcohol, and tobacco use. Smoking and tobacco use, nicotine can cause constriction of the arteries, which increases the blood pressure. Blood pressure is determined by two things: how much fluid is in the vessels and how stiff the vessels are. With time, the blood vessels become stiffer. They're not able to absorb the pressure as well, and the blood pressure increases. So there's not much we can do about age, at least not yet. But one of the things that we can do is make sure that the fluid in our system, meaning our blood vessels, is at an optimal level. So making sure that we abstain from high sodium diet. Some patients are higher risk of developing hypertension. African Americans develop high blood pressure more often than other racial and ethnic groups. Compared to whites, African Americans also develop high blood pressure at an earlier stage. Next slide.
All right. Thank you, Dr. Mohideen, for your insights on how our heart health impacts our blood pressure. We learned some great information from you. Remember, our audience, please add your questions to the chat box if you have any for Dr. Mohideen or if you have any for Dr. Barade. Now I'm going to ask that both of our presenters hop back on video together and we'll take some questions from the audience. Excellent. Okay. Looks like we have one in here in the chat. Does stress have an impact on blood pressure? And Dr. Barade, let's direct that one to you.
Yeah, sure. Thanks for the question. So stress definitely does have an impact on blood pressure. When you experience stress, your body releases stress hormones, and things like adrenaline, cortisol, all those can temporarily increase your blood pressure. That's also known as sort of acute stress-induced hypertension. Most of the time, this is a temporary phenomena, but if you have chronic stress, then obviously that can have a more prolonged effect on your blood pressure as well. During periods of stress, your heart rate increases, your blood vessels constrict, and all of this causes elevations in your blood pressure. This is sort of like a natural fight or flight mechanism, and it prepares you to deal with potential threats. Stress can also contribute to unhealthy coping behaviors too, and that can negatively impact blood pressure as well, such as overeating, excessive alcohol consumption, smoking, physical inactivity, things like that. So it's important, in order to reduce your risk of high blood pressure from stress, to understand how to manage stress effectively and to also maintain a healthy blood pressure as well. So some things to consider are relaxation techniques, regular exercise, healthy lifestyle choices, making sure that you have a balanced diet, adequate sleep, avoiding excessive alcohol and smoking. Make sure you have a good social support system, seek support from friends, family, support groups, and then talking to someone about your stressors can also alleviate some of that burden that comes along with that. And one of the most important things you can do is try to figure out your time management, because if you have effective time management and prioritization skills, then that can significantly help reduce the amount of stress and the feelings of being overwhelmed. I hope that answers that question.
Awesome, thank you. All right, Dr. Mohidan, I'm going to ask this one to you. At what point do you contact your physician if you are checking your blood pressure at home and it is reading elevated?
So normal blood pressure is less than 120/80. Now, pre-hypertension is anywhere from 121 to 129 and 80 to 89. So those are, if someone has blood pressure that's in that range, I would certainly make some lifestyle changes. And if you're noticing blood pressure is greater than 130/80, then I think it's certainly time to get in touch with your primary care physician.
All right, and then we'll go back to you, Dr. Varade. If my parents have high blood pressure, am I more likely to?
Yeah, so there's definitely, if your parents have high blood pressure, there's an increased risk for developing high blood pressure, but that's not the entire picture. I think with high blood pressure, what we need to know is that there are genetic factors as well as environmental factors that are playing a role. And so, if your parents have high blood pressure, then you may inherit certain genetic traits that make you more prone to developing this condition. But lifestyle factors such as diet, physical activity, smoking, stress, you mentioned before, all of those can contribute to the development of hypertension as well. And so it's important to understand if you have a family history of high blood pressure, and that way you can take proactive measures to try to prevent yourself from developing high blood pressure. There's things that you can control and there's things that you can't control. Obviously, genetics is not something that we can control, but there are some steps that you can do to reduce your overall risk, and those are the sort of environmental factors that take place. So things like maintaining a healthy weight, following a balanced diet, exercising regularly, limiting alcohol consumption, avoiding tobacco, limiting caffeine, managing stress like we talked about earlier. All of those things will help you to minimize your risk of having high blood pressure. And it's also very important to have regular checkups with your primary care physician or with your healthcare provider. And they can monitor your blood pressure on a regular basis and then also provide you some guidance for maintaining a good, healthy lifestyle.
Excellent, thank you. All right, another one here. We'll go right back to you, Dr. Mohidan. Can my high blood pressure be cared for by my primary care provider, or do I need to see a specialist?
No, absolutely. Your primary care provider is perfectly equipped to treat high blood pressure. You do not have to see a specialist such as a cardiologist or a neurologist. Most of the patients that have high blood pressure are very well cared for by their primary care physician. Now, there are some cases where you may be young and you have high blood pressure, or if there's a family history of high blood pressure at a young age, then at times you may need to see a nephrologist or an endocrinologist, sometimes depending on what the etiology, which are called secondary causes of high blood pressure, such as hormone production or narrowing of the arteries going to the kidneys, that can sometimes cause high blood pressure. But these usually represent less than 15% of all the cases that cause high blood pressure.
Here, all right, I have a question via the phone. Is there a specific time of day best to do your blood pressure? And should you always check at a consistent time?
So no, there is no right or wrong time to check blood pressure. I usually tell patients to check it at different times. You shouldn't always just check it in the morning or in the evening. Check it at different times and keep a log. And I usually tell people to keep a log on their phone, because there are times when they may forget to bring their notebook, but everybody usually has their phones with them. So I usually tell them to log it in their phone, so that they can, when they come in, they have it for their physician to be able to review that.
All right, another question just popped up. Is there such a thing as too low of a blood pressure?
Well, yeah.
Go ahead.
So in terms of too low blood pressure, I usually say no if you're not having any symptoms of lightheadedness or dizziness, and there really is no such thing as a low blood pressure. A healthy young person may have a blood pressure of 90 to 100, anywhere from 90 to 120. So that's normal. But, someone may think, oh, I have a blood pressure of 90, that's really low. No, not really. It's normal. As long as you're not symptomatic, it's not something to worry about.
Okay. All right. Well, I have a question. When checking my blood pressure at home, at what point should I call a primary care provider, or should I go to an emergency room if the reading is high? Dr. Barade, if you want to take that one.
Yep. So it's important to first of all understand what a normal blood pressure is when you're checking it at home. And like Dr. Moradin mentioned, your normal blood pressure reading is somewhere around 120/80. If your blood pressure is consistently over 130/80, that's where we get more concerned about hypertension, and that's when it's recommended to consult with your primary care provider to sort of discuss your readings and undergo further evaluation, and then also develop some sort of a management plan to see how we can address this and improve on this. And your healthcare provider can suggest some lifestyle modifications or medications, or even a combination of both of those. Usually when your blood pressure gets really high, so we're talking about over 160 or 180, and it comes in combination with the headache or chest pain, shortness of breath, blurry vision, those kind of symptoms, then that's concerning, and that's what we call a hypertensive crisis. And that's usually when you should seek emergency medical attention almost immediately. If you have consistently high readings where your blood pressure is not really meeting the target, and you're consistently over 130/80, then that's probably something to talk to your primary care physician about and see what else you can do to improve your blood pressure for the long term. Some of the symptoms to sort of watch out for are severe headache, chest pain or tightness, shortness of breath, confusion, changes in your mental status. If you have numbness or weakness in your arms or legs, if you have vision changes, blurry vision, or even if you have seizures, and really high blood pressures can cause you to have seizures. All of those things are very concerning for hypertensive emergencies or too high of a blood pressure. And those are things that should alert you to go to the emergency room right away.
Alrighty, next question. What is white coat hypertension? I've heard this mentioned before. And is there a way to check or monitor for this? Dr. Bohida?
So white coat hypertension is when you go to see your physician and you're a little anxious and your blood pressure tends to be a little on the higher side from anxiety and tension. It happens rarely in the office practice, and we see it. So this is where having a record of blood pressure performed at home is very important. So if you have normal blood pressure at home, and we can, sometimes we ask people to bring in their blood pressure cuff so we can calibrate, make sure that, if they're in the office and their blood pressure cuff is reading high number and ours is reading high number and all the readings at home are normal, that suggests white coat hypertension. One of the other things we can also do is ambulatory blood pressure monitoring, meaning a 24-hour blood pressure, which a cuff you wear on your arm, and that checks your blood pressure every 15 minutes, and then we can keep a log and correlate it. And if your blood pressure is in the normal range at home and only high when you're coming into the office, that can be labeled as white coat hypertension.
Okay. Looks like we might have answered all the questions in the chat, but I do have one more question if one of you wants to answer it. How high does your blood pressure have to be before it is truly a cause for intervention? So, whether they need medication or, if you suggest lifestyle changes.
So the cutoff really is 130/80. Anything over 130/80, if lifestyle modification has not helped bring down the blood pressure, it's time for medication. So that's really the goal. We want to get patients to less than 130/80. Some people are under the misconception, oh, well, as I get older, I'm allowed to have a higher blood pressure. That's simply not true. So really, for almost everyone, the blood pressure really needs to be less than or equal to 130/80. Anything above, if lifestyle modification has not worked, that can certainly be given a trial. then they need to be on medications, because there is a incremental increase in cardiovascular risk of stroke and risk of heart attack by every 10 point increase in blood pressure. So we really want to be able to make sure that we're reducing patients' risk by reducing their blood pressure. Your blood pressure is called a silent killer because most of the time, most of the people don't feel when their blood pressure is high. That's why, monitoring, self-monitoring is crucial.
Oh, another question came in. What type of diet do you recommend for someone with high blood pressure?
I'll let Dr. Varadi take that.
Sure. So obviously, when we're talking about controlling risk factors for heart disease and strokes and things like that, and also to improve hypertension, a healthy diet is really what's effective. There's something called a DASH diet, which is usually recommended for patients who have high blood pressure. And the key principles of that diet is that you want to eat fruits and vegetables, something that's rich in potassium, magnesium, fiber. You want to choose whole grains. You want to eat lean protein sources, things such as poultry, fish, beans, nuts, and you want to avoid high-fat meals such as processed meats or full-fat dairy products. You want to limit your sodium intake, reduce your salt intake by avoiding or minimizing processed or packaged foods. Choose low-fat dairy, moderate alcohol consumption, and then you want to reduce the amount of added sugars and sweets in your diet. And then overall, you also want to control your portion sizes as well. It's sort of like the cornerstone of the DASH diet, and that's kind of what works for most patients to help prevent them from or help reduce their high blood pressure. I don't know if Dr. Moy, did he have something more to add to that?
No, that was I completely agree with everything you said.
Right. It looks like we have another one from the phone. Do you have anything more to say on that, Dr. Varadi?
No, I was just saying the diet alone is not sometimes enough. There's a lot of lifestyle modifications that kind of play in together to overall reduce your blood pressure.
All right, so this is another one from over the phone. Is your blood pressure number altered if you are pregnant? And are there further cautions that should be taken when it comes to blood pressure monitoring while expecting?
Yes, so women that have higher blood pressure during pregnancy, they tend to have worse outcomes long term. They're more likely to develop cardiovascular disease. So it's crucial that if during pregnancy you have increased blood pressure, then long term, there's higher risk of developing hypertension and needs to be carefully monitored and screened. So what I would recommend is that women that have hypertension in pregnancy, they start blood pressure monitoring earlier than the normal screening at the age of 40, home screening. I would say get a blood pressure cuff at home, keep an eye on it, and long term there is increased risk of heart and vascular related incidents. So usually for treatment, the goal, if there's no history of high blood pressure, the target is a little bit higher, usually 150 systolic blood pressure over 90 before we start treatment during pregnancy for hypertension. We let it go a little bit higher. The blood volume increases in pregnancy, but normally blood pressure should not increase in pregnancy. So there can be conditions such as preeclampsia, so making sure that you get good pregnancy care is very important. We'll follow up with your obstetrician.
All right, and it looked like that was the last of our questions then. So if anybody else has any that you can toss them in right now. But we did discuss a lot of really great information, particularly on how blood pressure is impacting, not only our heart, but our brain. If there's one takeaway that you both want our participants to walk away with them tonight, what would that be?
I would say screening. If you don't have high blood pressure, make sure you get a cuff if you're over the age of 40, because with age, incidence of hypertension increases. Half the men over the age of 40 have high blood pressure. 44% of the women have it. So it's an astounding percentage of population. So screening is the key, and early intervention is very important.
I deal with a lot of stroke patients, and so hypertension is one of the biggest risk factors for strokes, and it's something that's easily modifiable. But oftentimes, having high blood pressure is kind of silent, and patients don't pay attention to the fact that their blood pressure is getting high because they don't always feel symptomatic from it. If your blood pressure is sort of in that above that 130 to 80 kind of cutoff, you may not know that you're having high blood pressure. Simply because it's not really doing anything at that time, but over time it's hardening your vessels. It's causing chronic wear and tear along your vascular system, and eventually those lead to to heart attacks and strokes. And if we intervene early enough and try to control your blood pressure early enough, that could potentially lead to preventing a lot of these outcomes with strokes and heart attacks down the road.
Wonderful.
The old adage, an ounce of prevention is worth a pound of cure. It's very true for hypertension.
Absolutely. Okay. All right. Well, I want to thank you both again for a very informative hypertension conversation. We really appreciate your time and also you sharing your knowledge about this important health issue. And I also want to thank Lehigh Valley Health Network for their support in tonight's conversation. We hope that you all enjoyed the conversation tonight. Please stay up to date on all of our events that we have and happenings across Pennsylvania by following the American Heart Association on social media. We are at AHA Pennsylvania on Facebook, Twitter, and Instagram. And again, thank you to Lehigh Valley Health Network. We really appreciate their support this evening. And thank you, everyone, and have a wonderful evening.
Thank you.
Thank you.